The Presidential Steering Committee on COVID-19 says indoor religious gatherings should be limited to 50% with full compliance to public health measures. A statement signed by the Secretary to the Government of the Federation and Chairman of the PSA, Boss Mustafa, says there had been reduced compliance to public health social measures, which had led to increased COVID-19 cases in the country. The committee, however, adds that it might be forced to introduce more restrictions should there be more increase in cases. The PSA reminded Nigerians that the country is now experiencing the fourth wave of COVID-19 and new cases have continued to rise. The statement further says indoor religious congregation should be limited to 50% capacity with full compliance to public health social measures, and face masks and hand sanitizers should be used at all times regardless of vaccination status while in public spaces.
And in the meantime, the Christian Association of Nigeria, CAN, has faulted the federal government on the 50% capacity gathering. CAN, however, asked Christians to adhere to COVID-19 protocols. The spokesman of the CAN president, Reverend Bayo Olajide, says it was curious that such directives were always issued during Christian holidays. Olajide, in a statement, queried that nobody is enforcing anything in the markets, banks, political rallies, and other social gatherings where COVID-19 protocols are grossly violated.
Okay, joining us to look at this issue is Dr. Ifedayo Adetifa, the Director General, Nigeria Center for Disease Control. Very warm welcome to Newsnight, Dr. Ifedayo.
Thank you very much.
Tell us, this new strain, Nigeria is third in Africa. How frightening can this be, considering our own population, too? What the SGF has said, it's like, you know, the protocols, we've dropped our guards.
Well, I think that the information about number of sequences needs to be slightly qualified. Okay, the absence of reporting is not the same thing as the absence of the variant. It just has to do with genomic surveillance capacity and reporting. So if you take 45 Omicron variants for 200 million people and compare that to whatever number is reported from small Botswana or Ghana by population size, it would appear that we are really much behind. But again, all of this reflects how much sequencing actually happens, and we do not do as much sequencing as we would like to do, because if you compare us to the UK, I mean, the people who are doing thousands of sequences per day, per week, and we are not quite there, even though we are also expanding capacity. The other thing to note is results will change because sequencing is an ongoing process. Work is going on in labs as we are going on now. So we hope we will provide an update on that number, either from our lab or from other partners in the network in the coming days.
What's Nigerians, Christian?
I just wanted to make a follow-up here. Sorry.
Yeah.
When you talk about the sequencing, I want to believe you're talking about testing and what have you. Are we doing enough testing? It seems, you know, like there's a law we've dropped the guard. I asked that earlier. So, are we getting the appropriate figures?
The short answer is we are not, and actually nobody is, because as you know, COVID is significantly, in significant numbers of people, they actually no symptoms. So if you have no basis for test, you actually do not know that people have COVID. What some of the research that has been done in the country in terms of looking at antibodies are the things that we produce to fight infection when we encounter pathogens. We know that the numbers of people in Nigeria in early waves who have antibodies to the virus far exceed any number of cases we have reported. So yes, it's an underestimate. Yes, all of us countries, especially in this part of the world, are not testing as much per capita compared to many of the developed countries. But I think what is useful is that we tend to test consistently at the same rate. So the patterns you find are actually truly reflective of what you are reporting.
Absolutely. And let's talk about the fact that you've actually confirmed now, that's the Nigerian Center for Disease Control, which you actually had, have confirmed now that we are officially in a fourth wave. So as an ordinary Nigerian who's sitting now and listening to the Director General, what should I know about this fourth wave of the pandemic? What should I be doing? And how can I avoid being part of the statistics?
Well, the fourth wave at this time of the year basically represents an exponential increase in the number of cases compared to a couple of months ago. And as we've seen with earlier waves, this time of the year is particularly high risk for respiratory infections in general. So it's the winter or the cold, dry time of the year when our respiratory tracts are under siege because of the dust and all of that. So when you add that to travel, increased movement of people, and then of course people not adhering to public health safety measures, if you introduce a respiratory pathogen, you simply get lots of transmission and an uptick in cases. So what to do at this time of the year to avoid being a statistic is, as what we've said in our campaign, is to celebrate responsibly. And to celebrate Yuletide, Christmas, Happy New Year responsibly means to do so in a way where we take individual and collective responsibility for ensuring our protection of family members, protection of those around us. And that we can achieve by ensuring that we mask when by mask use, by hand hygiene, by physical distancing, by avoiding crowding, by avoiding unnecessary travel, and very importantly, by getting vaccinated, because a significant proportion of Nigerians are currently not vaccinated. And if you've been previously fully vaccinated, like I am, then go get your booster. So I received my booster 2 days ago, for example. So this is what we mean by celebrating responsibly, and what your response should be as a Nigerian citizen to the fact that we've got a COVID wave and Omicron on the increase in the country.
Well, very quickly, you've gotten your third shot, and some critics would ask, even despite that, Israel, they are on their fourth booster shots now. So what's happening? They would say, if it's working, 2 shots, 2 jabs will just be fine. Why the third? Why the fourth?
Well, the question the response to that is another question. Who established the fact that 2 shots would be enough? So yes, in the early trials of the vaccines for the ancestral version of the virus, it was thought that yes, for that particular virus, the ancestral type, the 2 shots were fine. But how many times do we have to take children to get vaccinated, for example, against polio or against tetanus, against pregnant women, or anybody needs to take 6 shots of tetanus toxoid to get lifelong immunity. So vaccines have different schedules, and when you have a new pathogen that nobody previously saw, and a pandemic is a once in a lifetime event, nobody saw. There's lots that we're still discovering about this pathogen. And then there is precedence in places where flu vaccines are given. A different flu vaccine is given every flu season, because just like this SARS-CoV-2 pathogen, the flu virus changes from season to season. So you've got to prepare a different vaccine for the northern hemisphere and prepare a different vaccine for the southern hemisphere. And sometimes they don't really work very well. It's just that even at 40 or 50% efficacy, if you prevent that many deaths among the high-risk people, then that's significant.
Absolutely. You know what? Dr. Ifedayo, you're still with us here because, of course, we have to have a conversation about the fact that Omicron now is really dominating not just here in Nigeria, but across the globe. And also, this new pill that has just gotten the approval in the US and other climes. But, of course, you're still with us here on the Rise News. We'll have to head for a quick break now. When we return, of course, the Director General of the Nigerian Center for Disease Control joins us again. And, of course, we're having a conversation about how we're battling the pandemic here in Nigeria. Just stay with us.
We still have the Director General of the Nigerian Center for Disease Control, Dr. Ifedayo Adetifa. Thanks very much for staying with us. Now,
well, Christian, he was trying to give us some answers before we went on that break in terms of looking at, the fourth wave and what people.
Oh, absolutely,
really
yeah. Let's get your submission on the fourth wave and what people should be worried about, really.
So we've got a variant that is highly transmissible, more transmissible than Delta or the previous variant. And what we've seen over the last 3 weeks is a gradual replacement of the Delta variant with the Omicron variant. So even with a limited number of sequencing done, at least in proportion to the cases diagnosed, clearly the Omicron is driving some of what we're seeing in terms of increased number of COVID cases.
Over 4,000 in the last few days, coming from a country where we've had like 200, 300 in the last few weeks, and now going to the thousands, even 4.
Yes.
That's quite
How
frightening.
worrisome is that, and really what should we be doing as Nigerians generally, especially as we go into the Christmas holidays?
There is no magic bullets. I keep getting this question, and unfortunately, I keep repeating the same answer. We know the answers already. Get vaccinated. Okay, if you've not been previously vaccinated, get vaccinated now. If you have been previously fully vaccinated, as in you've received 2 doses, go get your boosters. Okay, part of the changes in the genetic makeup of this variant that led to this lineage, as we call it, make it more transmissible, which means it also makes it more likely to escape the impact current vaccines have against infection. Okay, not the impact that vaccines have against severe disease and death. Okay, and what we know, what the emerging evidence from elsewhere is that you can overcome that deficit or that advantage that this variant has by giving a booster dose to people who have previously been vaccinated, or ensuring that the unvaccinated people actually get their doses, which will be more recent and result in antibody levels that are high enough to achieve impact. So I use my mask religiously. Okay, critical. I try to have to distance, especially indoors. I had to go shopping this evening, and I kept looking at, people are standing too close to you behind. People are trying to push you forward.
They don't wear their masks.
And then I ended up sort of standing in an empty till, in front of an empty till, just so that I can get some distance from all of these guys who are either not wearing their mask or covering just their mouths and not their noses. Newsflash, people. Scientists have found out that, when you breathe, air comes out at both your mouth and your nose. So you need to cover them.
So you're still at risk.
Yeah, you're still at risk. So it is a big problem, in particular, when people are indoors. Okay, so people worry about, complaining about restrictions on indoor gathering. But the point is, when you are indoors with less than optimal ventilation, people probably not covering their nose. So you get these aerosols or these droplets suspended in air for really long times, and then you are at higher risk of breathing them in compared to if you are outdoors. And even if you are outdoors, it's better still, even physically distant, then you have a bit more protection. There are no absolutes. It's why you need to combine all of these various measures to get the most benefit.
So, Dr. Ifedayo, obviously, Nigerians are not observing the protocols.
Absolutely.
Again, here we've dropped our guards. Some people are even saying stricter measures should be employed to enforce those protocols. I know you are a scientist, and this issue has some political variety, like the lockdown that the world saw and its consequences. In this situation, with the new variants, the spiraling of COVID-19 in the country, would you recommend, as a scientist, a lockdown to the PSC?
A lockdown is slightly different. In the early days of the pandemic, we had sort of complete. What I would like to see is a bit more restriction or enforcement of restriction on gathering, enforcement of mask use, and hopefully that Nigerians actually appreciate that it is the right thing to do. Because on one breath, people complain that cases are going through the roof, and they are wondering what to do. But the answer is there. It's like we expect some magic solution from somewhere, but we all across the world have the same tools. I mean, context may differ as to how you apply them, but we have exactly the same tools.
It's universal.
Right.
It's universal.
And at the end of the day, Dr. Adetifa, let's look at the fact that, unfortunately, the uptake of vaccines in Nigeria is quite low. I know that's not your domain, but you are a member of the Presidential Steering Committee on COVID-19 here in the country, and you guys are responsible for, in terms of what we do in terms of managing the pandemic. There have been pills that have been recommended. I do know that the anti-vaxxers, it's not a problem synonymous in Nigeria, but we're seeing them, almost every day come up with whatever excuse they come up with, but they have the excuses as to why they will not get the jab into their arms. So the COVID pill, is Nigeria looking in that direction in the shortest possible time, so that way we actually assuage, the pandemic as it's currently ravaging our nation?
Well, the pill has been made by Pfizer and others, just like vaccines have been made, and we know again the journey towards even making vaccines available in our part of the world. It's a journey. I mean, if there's anything that the pandemic has shown, is that knowledge is power. Data is the new oil. It's not how much natural resources you do. So you do not, we cannot, there are efforts in being made to now get us to move into vaccine manufacture and move into drug manufacture, but it's not going to happen overnight. And sadly, a lot of that's not going to happen in time for this pandemic, or in time for the person who is going to be admitted tomorrow, or sadly may die in the next couple of weeks. So the question is, what do you do in the meantime? Okay, you make use of the tools that you have, and hope that for future cases that the new tools that are coming on board, just like the vaccines did in the past year, will also become available. But as we say, prevention is always better than cure, because cures almost never work 100%.
Absolutely. Prevention is better than
Definitely.
cure.
And go get vaccinated. It's important. Christian has received 2 jabs.
Oh, yeah.
I have received
for my booster,
both of mine, and I've gotten my booster as well,
Sure.
because at the end of the day, that's the only way, according to the science, that's the only way we can defeat this pandemic on time
and
get back.
the protocols.
Of course. And
Thanks
get
so
back
very
to
much,
some
Dr. Ifedayo
semblance of
Adetifa,
normalcy.
Director General, Nigerian Center for Disease Control, for coming to, add spice to news.
Absolutely.